Hey everybody, after just making several videos on Vertigo, it kind of dawned on me to maybe make this video and go backwards a little bit and explain what Vertigo really is and how you can explain it to a patient. So I'll try to make it brief. I know I've got other videos that kind of explain what it is. So let me just kind of walk you through that because I think this will help you when you're working with patients. So I'll probably put this in the sequence like video 0 or something like that. So basically, let's just look at the most common type of vertigo, which again is that posterior canal vertigo. This is where people get the vertigo when they tip their head forward or back, or when they roll over, do quick head turns, things like that, and it's the sensation of spinning. So if you've gone through some of these videos already, the ones after this, and you kind of understand what's happening, then you want to get good at explaining it to patients. So basically the way I talk about it is you have these canals in your inner ear, these little hoops is a good way to put it. And inside these hoops there's fluid moving around. And an easy way to kind of jog someone's memory is when they were like a kid and they were spinning around in circles and then they would stop and they would still feel dizzy. And so what was happening essentially there is that normally these fluid-filled canals, as your head moves in different directions, the fluid is moving inside the canals. So depending on which direction you're moving your head, it could be a three-dimensional direction because there are 3 different types of canals and there are 3 different orientations. So the fluid is moving inside the ears. So typically you move your head one direction and it sends input to your brain telling you where your head is in relationship to gravity. That's the function of your inner ear. And when you were a kid and you were spinning around so quickly, the fluid was moving and moving and moving, and then when you stopped, the fluid kept moving, and that was confusing to your brain. So the fluid essentially was telling your brain that you're still moving, while the sensation in your feet and your visual input is telling your brain that you have stopped moving. So the brain gets confused, and that's what results in vertigo. So that's a good way to kind of put it in perspective for people, again, is that fluid moving around in the inner ears. Like I mentioned, there's 3 sets of canals in there. So you've got 3 canals on each inner ear. And there's ones that are oriented front to back like this, so for head up and down movements. Those are your posterior canals, they call them. There's ones here that go in this direction, so head movement side to side. And then there are ones here for head turning motions. Those are your horizontal canals. So you've got this fluid in all these different canals. And so the way I talk about it, and people that come in who have vertigo or BPPV, they'll usually have heard about like little crystals or little rocks being stuck in the canals. So it's good to kind of use their terms at first. You know, in the PT world, we would call these little rocks or crystals the otoconia. And they're saying, well, how do these crystals get in here in the first place? So let's talk about then, explain to them how they got there in the first place. And so what I usually say is you have these adjacent organs to the canals, and these adjacent organs are your utricle and saccule, which I never mention those names to folks, so I don't think they need to know. But you have these adjacent organs, and basically these organs have a big pad of jelly, and these little rocks or crystals are stuck to it. Now, if you want to really know why those are there in the first place, those little rocks that are stuck there to the jelly, basically if you move your head to one position and then you keep it there, that's giving your brain input that you're still in that position, whereas the fluid in the canals only gives your brain input when you're moving. So there's similar functions, but they're quite different, because again, if I leave my head here and it's stuck there, the fluid in my canals is no longer moving, so it's not telling my brain anything. But those little crystals, because of the force of gravity, are still pulling that jelly pad down towards gravity, so it tells my brain where my head is during a static position. So anyways, what I explain to these folks is that those little crystals, that's where they live, is in these adjacent organs, but the fluid that moves between these adjacent organs and all of the canals is continuous. So for whatever reason, those little crystals or rocks got dislodged. Some folks didn't really do anything or can't pinpoint why. Or some people have had a fall or a car accident, or they've ran into the wall playing racquetball, something like that. And for whatever reason, those crystals floated into one of the canals. Now, when it floats into the canals, whether it's a couple small ones or one big one, whatever it may be, the fluid movement in that canal is now going to be changed, and it's going to be restricted or occluded. So whatever it may be, the fluid is no longer moving like it used to move. So now, when you move your head in certain positions, like when they're tipping their head forward or tipping it back, the fluid on the unaffected side is moving just normally like it always does, but the fluid over here isn't moving normally anymore. It's either slowed down or it's just completely stopped. So again, this side is telling your brain one thing, this side is telling your brain another thing, and just like when they were spinning around as a kid, whenever the brain gets conflicting information, for whatever reason, it tells you that you're spinning. So that's how I usually explain it to folks. So the fluid is being, those little rocks or crystals have floated in, it's slowing down the movement of fluid or it's blocking it, and now the signals to your brain are no longer in agreement, and your brain just perceives that as spinning. So that kind of tells you, kind of lets you know how you can tell a person what's going on, and then you can kind of explain how you test it with the Dix Hallpike. I don't usually explain in too much detail. I just say we're going to test it and figure out which side is affected. And then once you move on to treatment then, so the most common one after Dix Hallpike, if that's positive on one side, you're going to move on to the Epley. And basically what you're saying then is we're taking you through this series of rolls or head movements essentially, and we're just trying to get those crystals to roll all the way through that canal and go back out where they belong to that adjacent organ. Once you get them there, we want them to stick back onto that pad of jelly. And that leads into one of the videos I make later in the series too about the instructions you give them after you perform like the Epley, and because you want to get those crystals to stick. So again, I think it's really important when you're treating patients, obviously with anything, but with vestibular and vertigo, is just explaining to them exactly what's going on. It gives them a nice understanding of how you're doing what you're doing, why they're feeling the way they're feeling. And then hopefully, if you have good success with repositioning them with the Epley or something like that, hopefully they feel a lot better and they understand how it worked. And then they know why you're asking them to do certain things or avoid certain things for the next couple of days to make sure those crystals stay where they belong. So hopefully that helps you just kind of understand yourself what it is and help you understand how to put it in layman terms for your patients and just explain to them why it's working and what's working. So there you go. Thanks.